Thanks for visiting Medicare on Video. I'm Keith Armbrecht, and I'm going to go through Medicare Part A and show you everything that you need to know in less than 3 minutes. It's certainly important to understand all the pieces of Medicare, so make sure you look at my other videos that go through each and every piece of Medicare so you can get a full understanding. If you do have questions, I'm happy to help with any of it. You can send me an email, keith@medicareonvideo.com, or you can give me a call at 877-88-KEITH. I help people across the country make the right Medicare choices, and I can absolutely help you as well. So let's get into Part A, and we're going to try and do it in less than 3 minutes. So let's go ahead and start. So Medicare Part A is kind of the foundation of Medicare. It's where everything starts. But for some reason, Medicare breaks their health insurance into different pieces. It's very similar to what you may have had previously at work or through an individual plan. They just kind of break it up into different pieces. So Medicare Part A pays for things that go on inside of the hospital. So it pays for the hospital room. It pays for things that are part of the hospital. So it's inpatient care. Now, it doesn't necessarily pay for the doctors that are in the hospital. That falls under Medicare Part B, and I have a video going through that as well. So make sure you take a look at that. But Part A generally covers the hospital part of your healthcare. So what is the premium cost to Medicare Part A? Good news is, for most people, there is no cost for Part A. And to qualify for no cost, you simply have had to work 40 quarters over your lifetime. So 10 years. In other words, you've been paying Medicare tax all these years while you've been working. So that's what's going to cover your Medicare Part A cost. So there really shouldn't be any cost to you for Medicare. So your out-of-pocket expenses are a little different on Medicare Part A. And it's important to understand this part for sure. So Medicare Part A first has a $1,408 deductible for each benefit period. And a benefit period is a 60-day window. So if you were to go into the hospital for a certain condition, you would have a $1,408 deductible. If 65 days later you went back in the hospital, you again would have that same deductible. Certainly important to understand how the deductible works. Now, days 1 through 60 in the hospital, there is no coinsurance. Days 61 to 30 in the hospital, there's a $352 per day coinsurance. So that's pretty significant. Days 91 plus, $704. Now, obviously, we don't want to be in the hospital for more than 60 days, but Medicare supplement plans generally cover these costs. So make sure you understand how a Medicare supplement plan. So this is original Medicare. Most people get a Medicare supplement in addition to it that covers these out-of-pocket expenses. So that gives you a pretty good idea on Part A, and I think we're under 3 minutes, so that's a great thing. And if you have any questions, again, send me an email. Feel free to call me. I'm happy to help with anybody. There's no cost to you to use my services. The way I am compensated is if you do get a Medicare supplement, that insurance carrier pays me to act as your service agent now and in the future. And generally, it's in the future when you really might need my help. So hope you found this helpful. Have a fantastic day.